Uh, Lake knows, sir. Like, just a minute, sir.
Me, like Mahesh.
Yeah, we have the presenter ready. Lavina, are we live?
Yes, sir, you're live.
Yeah, Saikiran, please start.
Good evening, everyone. Welcome to the third edition of the Invade International Student Curriculum. We are here with the most interesting part of our conference, the research paper presentations. To grace us, we have our honorary jury. Let me introduce with Dr. Purushottam Giri, MBBS, MD Community Medicine, FIA PSM, MIPHA, CCE BDM, Professor and Head of the Department, Community Medicine in the Indian Institute of Medical Science and Research, Badnapur District, Jalna, Maharashtra, with more than 17 years of experience in teaching field. To his honorary, he has more than 180 scientific papers in various national and international index medical journals and is currently the Secretary General of National IAPSM for the year 2022 to 2025 and Vice President for IPHA Maharashtra State for the year 2021 to 2024. We are extremely honored to have you with us today, sir.
Thank you. Thank you.
We have the other jury, Dr. V. Niranjani Ma'am, MBBS, DNB, Emergency Medicine, Emergency and Trauma Specialist, a certified AHA, BLS, and ACLS instructor, and Emergency and Trauma Consultants at Alexis Hospital, Nagpur. We are extremely honored to have you with us today, ma'am.
Thank you. Same here.
So, a general instruction to all the participants, you'll be given 5 minutes of time to present your PowerPoint. At 4 minutes, there'll be a warning buzzer, and at 5 minutes, we'll completely interrupt your presentation. Judges, kindly note that due to the time restrictions, we have to limit our question and answer session to only 2 minutes. Over to Lekha.
Good evening, everybody. I'd like to introduce the first presenter for tonight. It's GVS Mahesh Kumar, and he will be presenting on the prevalence of MRSA nasal carrier state among pediatric patients and paramedical staff in a tertiary healthcare system. Over to you, Mahesh. All the best.
Good evening.
Just give me a minute. Should we start?
Actually, the screen is not sharing.
Oh, all right. Mahesh, I will give you a warning at 4 minutes.
Okay.
Lavina, make Mahesh the co-host so that he can present his screen.
Just a minute. Lavina, allow the participants to share the screen.
Yes.
Lavina, is it done? Mahesh, you can start sharing now.
Actually, is it visible? I tried to share.
It isn't yet.
Yeah, it's visible now.
Okay. Good evening, everyone. Myself, GS Mahesh Kumar. I'm a third year med student from Mamta Medical College, Khammam. We did a research on prevalence of methicillin-resistant Staph aureus nasal carriage state among pediatric patients and paramedical staff in a tertiary care hospital. As we all know, community-acquired methicillin resistance and hospital-acquired methicillin resistant Staph aureus are well-established infections, and the source of the infection is usually a carrier of MRSA. Community-acquired MRSA causes severe skin and soft tissue infections, whereas hospital-acquired MRSA causes severe blood infections and pneumonia and other systemic infections. Staphylococcus aureus and MRSA account for the 40 to 60% of nosocomial infections. Nasal colonization of MRSA in children showed variable prevalence rates ranging from 0 to 20% in various studies. Our approach to the methodology. We did a prospective cross-sectional study for about 2 months in a tertiary care hospital. After obtaining the institutional ethical committee clearance and informed consent from the participants, the inclusion criteria, children up to the age of 14 years and admitted in NICU, PSU, and pediatric wards, and the duration of hospital stay more than 72 hours were included, with the paramedical staff posted in the respective departments. Exclusion criteria, children attending OPDs admitted for less than 72 hours were excluded from the study. The study procedure, age, sex, and the underlying health condition with duration of hospital stay was taken in a pro forma design for the study. 2 pre-monster nasal swabs were used to collect the samples from anterior nares and were directly transported to the microbiology lab. These swabs were inoculated on high chrome rapid MRSA agar plates, which were incubated at 35 degrees for 48 hours. Yellow greenish colonies with luxuriant growth was considered as MRSA and further confirmed by conventional methods like gram staining, catalase test, tube coagulation test, according to the CLSI guidelines 2022. Methicillin resistance was confirmed by using cefoxitin 30 microgram disc diffusion method. For internal quality control, a known clinical isolate of MRSA was used and as a positive control. For negative control, a known strain of Staphylococcus aureus ATCC25923 was used as a negative control. Mupirocin local application is advised for MRSA nasal colonized people for about 5 days. The limitations of the study were post-treatment swabs could not be collected as the patients were discharged and the paramedical staff was not willing to give the samples. This is the swab we used and the agar plate with the MRSA colonies, gram staining, catalase test, tube coagulation test, cefoxitin disc diffusion method test. Results, total of 100 samples were collected from the patients and paramedical staff. 21 showed MRSA colonization. Among 21, 18 were from the pediatric patients and 3 were from paramedical staff. In that, 15 are from age group 0 to 5 years. MRSA nasal colonization was equally distributed among NICU, PSU, and paramedical staff. Distribution of MRSA nasal colonization among pediatric patients. This is a table of form showing number of MRSA and the number of samples collected. This is in paramedical staff. Graphical representation of number of MRSA in the total study. Gender-wise distribution. Age-wise distribution. And there was an equal distribution of MRSA in NICU, PSU, and pediatric ward. Distribution in paramedical staff. Discussion. The emergence of MRSA in the community is of greater importance and the subject of
4
multiple
minutes up.
studies in a variety of clinical settings and from many parts of the world. In one of the studies, Aaron found that critically ill colonized with MRSA were at significant high risk of subsequent MRSA infection.
Mahesh, if it's 5 minutes, you need to stop.
Okay, these are last slides.
It isn't. It
Davis-
isn't. Go.
Davis and colleagues reported a 9.5-fold increase of subsequent infection in critically ill patient colonized with MRSA compared with those not colonized. Out of 100 samples, 76 were collected from the paramedical staff and 24 were from paramedical staff. Out of 76, 18 were positive for MRSA nasal colonization with a prevalence of 23%. In one of the study done by Schillinger, 21% of percentile of MRSA was observed in that study. Out of 18, 11 were from female children and 7 from male children. There were no studies showing sex-wise distribution of MRSA nasal colonization. Mean age group of MRSA nasal colonization is about 0 to 5 years of age, which was correlated with a study done by Aaron showing 4 years of median age group. In our study, the paramedical staff were not interested to participate in the study. Hence, 24 samples were only collected. Out of 24, 3 were positive for MRSA with a prevalence of 12.5. Conclusion, regular screening of MRSA carriers among hospitals, patients, and awareness regarding the precautionary measures among healthcare workers can reduce the MRSA infection.
Please, time's up,
Regular
Mahesh.
Regular screening of have to be done. Thank you. These are my references. Thank you.
Thank you, Mahesh. You are presented very nicely. Your topic is very good. There is only one question, 1 or 2 questions from my side. Have you taken a 100 sample size? You justify why it's 100 figures, your sample size, just justify.
Actually, sir, what we did was in the 2-month period, we tried to take the samples from the patients who were admitted. So the number of admitted cases, how many of them are there? We took it for 72-hour time period, and we got around 76. So we didn't had any, like, only 100 samples were not taken. Like, we only had 76 samples in that 2-month period.
That means you want to say that in a 2 months of you have not mentioned even your study duration also, even study area also, study population also. So these are in methodology section. You have not mentioned the study area also. You want study population and which sample size.
Actually, sir, sample size, this was a cross-section prospective study in a
That is a
tertiary
study
care
design.
unit.
That is a study design. It's a prospective cross-sectional study. It's a study design. But what about the sample size? It is a purposive sampling size. It is a what type of sample size you are taken and why it becomes 100 only, not 1 not 10, why not 84, 94, maybe 70. Why
Actually,
100?
sir, we had around only 76 pediatric patients who were admitted for more than 72 hours, with including NICU, PICU, and pediatric wards. The number of samples came into our hospital, like we tried to take more, but patients were discharged before 72-hour time period. So we
Okay,
had only.
last question. Every cross-sectional study has its own limitation, correct?
Yes, sir.
What is your limitation of your study in one sentence?
Actually, our limitations of the study that we couldn't differentiate it from hospital acquired and community acquired, and one of the different limitation was we couldn't take post treatment swabs. Clinically, we couldn't take that as they were discharged and they were not followed back.
Thank you. Dr. Niranjani ma'am.
Yes, sir. Good evening, Mahesh. Your
Good evening,
presentation
ma'am.
was very good. I'll also have just 1 or 2 questions. What did you do with the patients you found positive as carriers? Did you give them any treatment or?
Actually, ma'am, the one who were positive and who stayed in the hospital, like who were admitted after the results, we treated them with the mupirocin after the sensitivity testing, antibiotic sensitivity testing. And the paramedical staff who were carriers, we treated them with the mupirocin. Specifically, mupirocin local application was recommended for 5 days.
Okay, so how was it done? Like, was it a gargle or was it a gel kind of application? Or what exactly?
It was a jelly kind of application. We recommended them to take a swab kind of thing and apply it anterior nares in the anterior nares.
Okay. And you said that you had collected the samples from the anterior nares. So was the transport chain maintained? Like, what was the transport medium used for it?
Actually, ma'am, we didn't use any transport medium like I showed the swab here. The swab
That is
was
the reason.
came in a like sterile container, so we didn't use anything. We directly transported.
Okay. Thank you.
Thank you.
Yes, I Kiran.
Yes, sir. Actually, the girl who is taking care of. Thank you, Mahesh. That was a wonderful presentation. Now we have the next presenter, Dr. Prashant Upadhyay, a study to assess and compare the prescription pattern and appropriateness of antimicrobial use in a government tertiary hospital in India, Uttar Pradesh. Dr. Prashant Upadhyay.
I think Dr. Prashant is not here. You can proceed to the next presenter.
Next, we have Dr. Sneha Shah. Dr. Sneha Shah,
Hi, sorry. So next we have Sneh Shah. Their topic is impact of COVID-19 on lifestyle and menstrual health among females with PCOS. Can we have Sneh Shah here?
I think she's also not there. Go to the next presenter.
Moving on, we have Revan George de Silva. Their topic is expressed breast milk, awareness and opinion on storage and utilization among mothers in tertiary healthcare center, Belgavi.
Yeah, I'm here. Just give me a minute. I'll share the screen.
Are they not here as well?
They are.
They are.
Even he's just sharing the screen.
It's showing I'm not able to share my screen. Host disabled participant screen sharing.
Yeah, Sai Kiran, you can find the option like enable sharing screen option. Please enable it. Yeah, Lavina, are you there?
Is my screen visible?
Yes, it is, Revan.
Okay, I'm audible, right?
Yeah. Could you
Okay,
speak a little loudly? Maybe you're just really muffled.
Yeah. I'll keep the earphone near me.
Yeah, that's perfect.
Okay.
So I'll interrupt at like 4 minutes, but you keep going and then the alarm will ring at the end of 5 minutes, okay?
Okay, yeah.
Yeah. Start.
Okay. Just a minute. I'm not able to.
Sure.
Okay, yeah, I'll start now.
Start.
Yeah. Good evening, everyone. Myself, Revan George de Silva, an intern from Belgavi Institute of Medical Sciences. I'll be presenting on the topic express breast milk, awareness and opinion on storage and utilization among mothers in tertiary healthcare center in Belgavi. The authors declare no conflict of interest, and we had obtained institutional ethical committee clearance before initiating the study. Introduction. For newborns and infants, breast milk is the best source of nutrition. To achieve optimal growth, development, and health for the infants, they should be exclusively breastfed for the first 6 months of life. The reviews and research findings show that the first-time mothers and working mothers become a prey for formula feeds due to structural, functional, and organizational limitations. To tackle these problems, express breast milk is an effective method that is to store, utilize, and feed the baby immediately or at a later point in time. To practice expression of breast milk, there's a need for adequate knowledge and right attitude regarding storage and utilization. Aims and objectives of the study. To determine awareness on storage and utilization of expressed breast milk among mothers, to find an association with awareness and utilization with selective variables such as area of residence, level of education, occupational and socioeconomic status, and to determine the need and acceptance of expressed breast milk, that is EBM, in the continuity of breastfeeding. Methodology for study. It is a cross-sectional study among gravid women conducted in Tertiary Healthcare Center Civil Hospital in Belgavi. It was for a duration of 1 year. We had taken sample sizes 200, and it was the technique we had used was non-probability purposive sampling technique. Gravid women attending tertiary healthcare center in both IPD and OPD between the age of 18 to 45 years were included in the study. Exclusion criteria was those beyond the age group of 18 to 45 and not willing to participate in the study. Our questionnaire contained 2 sections, section A and B, A being participants' baseline pro forma, and B being the questionnaire proper. Data collection methods. We had obtained ethical committee clearance from the institutional ethical committee and obtained the permission from HOD and treating doctor, and we had administered informed consent with the patient before data collection. As per statistical analysis, data was depicted in Microsoft Excel. We had subjected to description and inferential statistical evaluation for frequency area-wise comparison and chi-square analysis at p less than 0.05 level of significance. These are my results. We found that there was significant difference in knowledge scores coming to variables such as age, religion, and education level. And those who had learned or learned about express breast milk, or who had an idea to store and utilize, or even heard about it. Discussion. A study by Prabhu P. et al. Reported that the knowledge about methods of express breast milk and storage was not satisfactory. Our study was also congruent with the study reported by Ekamaram et al. Showed that an educated woman had higher scores, but there was significant difference among religion, uh, age, and age, which might be attributed to social and multifactorial constraints. Conclusion. The results of the study indicated that the awareness of the women on storage and utilization of express breast milk was average to good, with majority of the women in these subgroups. Milk banks would be an effective intervention to ensure exclusive breastfeeding to help in continuity. Measures like baby-friendly hospital initiatives, community IEC, publicizing benefits of express breast milk, and donation and usage. These would help reducing existing malnutrition and strengthen the mother-child institution. Further studies would be needed, taking a larger sample size, and to assess the feasibility of milk banks, so that the current study would help in progression of the literature. These were references. Thank you so much. I'll be taking questions from the judges.
Yeah, thank you, Dr. Revan George De Silva. Your presentation is very nice, very good, and topic is very. Can you hear me?
Yes, sir. Yes, sir.
Yeah. Okay. So even your methodology, you have it that the study sample is 200.
Yes, sir.
How that justify your sample size 200?
Sir, we had there was a study conducted by Prabhu P. et al. In Hyderabad. It was published in, I think, 2018. So we had taken that study into consideration, and we had used the formula sample size equal to, I think, n square pq by d square. Sorry, z square pq by d square. So my statistician, I had actually approached my statistician ma'am for this. So she had told me it was a z square value at 1.96 confidence interval, and for P and Q, the prevalence of the study in the Hyderabad study was at 68%. So P value would be 0.86 and Q would be 1 minus P. So that would be around 32%, sir. And coming to D square,
you have mentioned your duration 1 year. In which year? It's 2020, 21, 22,
sir,
2019.
It was in 2020 to 2021, sir.
So there, you have not mentioned in your methodology the duration. You just mentioned 1 year. 1 year of all. Which year?
Yes, I'll mention that.
One thing you have shown your result table, age, religion, and education isn't significant, right?
Yes, sir.
And even you have mentioned also the knowledge is average to good. How you score that average to good knowledge?
Sir,
within a score system, have you used for this? What is meant by average? What is meant by good? What is meant by what?
Yes, sir. So we hadn't found any study or any previous references which had given the scoring for a questionnaire, sir.
How much question you have? How much question you ask in your study?
Sir, knowledge? Of knowledge, it was around 8 questions, sir.
8 questions.
So knowledge. Sorry. Yes, sir.
Okay. 8 questions on knowledge.
Sir, we had taken the questionnaire of knowledge, attitude, and practice. So we had got a final score of 29. So in that 29, since there wasn't any previous references showing that there could be a division. So what we did was we took median, less than equal to median and greater to median. We had divided these into 2 subgroups.
My question is very simple, doctor. It's how you become average to good knowledge. You have mentioned even in conclusion, it's an average to good knowledge.
Yes, sir.
Once we had divided average, when you say it's good.
Yes, so once we had divided into median, so we had once we had got the median range of all the participants, then we had divided into 5 subgroups based on the median scores, sir. So then we had considered it as very poor to good. I mean, very good knowledge scores, sir.
And even your aims and objectives, you have mentioned to determine the something, and there are 2 objectives: to determine, or you have to say something else. Determine is an appropriate word. You just use a slide, aims and objective slide.
Yes.
Aims and objective slide.
Yes.
First and third to determine, and third one is also to determine.
Yes, sir.
So is it a determine word is an appropriate?
So I think assess would fit in better, sir.
Huh?
To assess would maybe fit in better, sir.
Okay, okay, okay. Niranjana ma'am.
Yes, Dr. Regan, I wanted to ask you that when you found out that the knowledge was average to good, or in some cases was poor, so how did you share the knowledge of express breast milk shelf life, the storage patterns with them?
Ma'am, since many of the participants, once we get to know that there was not very good knowledge regarding this. So in either the time of the collecting the question, once we had collected, we had completed the question from the subject, we used to explain to the subject on the spot how we proceeded was we used to explain to the subject that you can practice like this, since many of them were expressing but rather throwing it away and not storing it. So we had told them and educated them regarding some of the methods which
How
could
do
have
you
been done.
store the
Sorry, ma'am.
how do you store the express breast milk?
Ma'am, it can be refrigerated, ma'am. Once you've expressed it, you can put it in steel or glass containers, ma'am, and then you can keep it in refrigerator up to for 1 day or something, ma'am. Then you can just warm it rather than boiling it. Then you can consume it the next day if you had to utilize it within a day or so. While coming to deep freezers, if you have any facility, like if it's there in milk banks or so, ma'am, if it's in deep freeze, it can be kept up to nearly 6 months, ma'am, in deep freezers. So that's how I think it be helpful, ma'am. That's how we told the
And
participants.
when it is donated, like you have mentioned, even the awareness about donation, milk
Yes, ma'am.
donation, and in the results you have mentioned that there is need of milk banks, right?
Yes, ma'am.
So when the milk goes to the milk bank,
Yes,
is
ma'am.
it sterile, or is it what process does it undergo? Is it directly given to the babies?
Ma'am, no, ma'am. I think there'll be an initial phase of sterilization, ma'am. I'm not sure the process of sterilization, but there'll be a phase of sterilization, and then they'll be storing it, ma'am, and then it'll be produced.
Actually, when mother's breast milk, express breast milk, is given to somebody else's child,
Yes,
it's
ma'am.
generally undergoes the pasteurization process. It's a
Okay.
different process, like the blood bank storage. The milk bank storages also have this process. So they undergo this,
Okay.
and then it's provided in the NICUs or PICUs, whichever babies need them.
Okay.
Okay, thank you.
Thank you.
All right. Next we have Bila L.R. Sathwik. Their topic is comparison of efficacy of silk protein dressing versus conventional dressing in chronic non-healing leg ulcers, a clinical study.
I'm sharing my screen. Is it visible, sir?
Hey Satvik, yes, it's visible now. Do you want to begin?
I want to. First of all, very good evening, speakers and respected judges. To heal.
Please
Satvik,
check
I'm
your
so
please check
sorry.
your
since,
voice.
Yeah.
Please check your voice. You're not audible. Satvik, are you with us?
Yeah, I'm with you.
We couldn't hear you that well, Satvik.
Hello, is it audible?
Yes,
Hello.
Satvik, you're
Yes, you're audible. Could you share your screen?
Is it audible?
Yeah, you're audible.
Okay.
You're very clear. Could you share your
Yeah,
screen?
okay.
Are you ready, Satwik?
Yeah, I'm ready. Is it visible? Screen is visible?
Yes, it's visible.
Yeah, thank you, thank you. First of all, very good evening to our respected judges and my fellow people. And yeah, coming to the topic, a silken touch to healing. Though this metaphor seems very big thing, yeah, while we dig deep into this, it seems very simple. Yeah, my study deals with a comparison of efficacy of silk protein dressing versus conventional dressing in chronic non-healing leg ulcers, which is a clinical study. Introduction. Chronic non-healing leg ulcers are debilitating to have and a significant impact on the patient's quality of life, compromising his sleep, mobility, and work capacity. Chronic non-healing leg ulcer management is challenging as the moist environment required for formation of granulation tissue also favors bacterial growth. Although conventional wound dressings favors wound healing, its sensitivity to bacterial growth limits its effectiveness. Coming to our silk protein. Silk protein can be found in powder, sheets, foams, and in many other forms. The powder dressings conforms to any wound shape and size and is simple to apply and which is available for only 1000 rupees cost in a bottle outside. And silk protein shoots are finely mixed to allow for easy drainage of exudates, which are considered necessary for fibroblast and macrophage migration and the production of extracellular matrix. These dressings contain silver nanoparticles embedded in silk protein to control microbial growth and promote faster healing through fibroblast proliferation and collagen deposition. Aims and objectives to compare the efficacy of silk protein form dressings and conventional dressings in chronic non-healing leg ulcers and to compare the rate of wound healing in two groups during the study. Materials and methods. This study is a prospective comparative study which compares the incidence and study sample includes 40 patients. Among them, 20 patients have silk protein form dressings and another 20 people have applied conventional dressings which act as a control group. This study includes patients of age group of 25 to 70 years and who has long-standing non-healing ulcers, who are non-diabetic and diabetic, ulcers more than or equal to 4 weeks duration and less than or equal to 15 centimeters square in size. This study excludes patients who have the platelet count of less than 1 lakh per mm cube and patients with known case or suspected case of osteomyelitis and who has presence of cellulitis, inadequate perfusion, ischemia, and gangrene, and patients who are unwilling to participate. Study process. The ulcer is cleaned with the normal saline and silk protein forms are applied in the subjects and results. Out of 40 patients, 24 were male and 16 were female, with a male to female ratio of 1.5:1. It was observed that patients receiving silk protein form of dressings had a better wound contraction of 43.4% as compared to the control group of 14.3%. Conclusion. The wounds in subjects treated with silk protein dressings contracted more than the wounds in control group, which indicates silk protein dressings is an effective modality to facilitate wound contraction in patients suffering from lower limb leg ulcers and can be used as an adjunct to conventional mode of treatment for healing of lower limb leg ulcers and help to reduce the financial burden of our healthcare system and improve the patient's quality of life. Thank you.
Thank you, Bilal Swastik. Your presentation is very nice. My question is, you have mentioned your study design is a prospective comparative study. How? Is it a prospective comparative study? What it means?
Dissecting the term, prospective means the study is going in one direction in the timeline, and comparative study is because we compared the incidence of wound contraction in two groups, uh, which one group which has a silk protein dressing and another group which has a conventional dressing. So it's a prospective comparative study.
Okay. Our second one, you have taken the sample size 20 in study group and 20 in control groups.
Yes, sir.
As per the statistical rules, at least the sample size should be in 30 minimum. But even that, you have taken only 20 to each study and 20 for control. Your comments on that?
Yeah, sir. If sample size decreases, then technically the standard error also increases. But during a 4 months period of time, we are able to find those many number of cases, sir, because we have a lot of things which are has an inclusion criteria and exclusion criteria. Specifically, we found only few cases, sir, few patients.
Okay, but you have drawn your conclusion and your results are totally different. Ideally, the conclusion should be on the result base, right? But your results telling something
Yes,
and your conclusion is something. The conclusion should be on the basis of results only. Whatever the results,
yes, sir.
on the basis of results, you have to draw your conclusion.
Yes, sir. Our results show that the silk protein dressing has more efficacious than the conventional dressing, sir. Because while comparing the wound contraction, which we done with a bubble wrap, we're able to find that the patients which had the silk protein dressing has much more faster and greater rate of wound contraction and healing.
Okay, okay. Anyway.
The
Over
similar
to
to the
Nirangana,
silk,
ma'am.
sir, because
Thank
of
you, thank you, thank you.
42%. Yes, sir. Yes, sir.
Okay. Good evening, Satvik.
Good
I
evening,
just wanted to ask you that you mentioned the cost actually, cost of the silk form dressing, and also the forms that it is available in. So the place where you conducted
Yes,
your
ma'am.
study, was it made available? In which form was it made available?
Sheets, ma'am. We applied sheets, silk
Okay, so
sheets.
was it cost effective than the conventional dressing?
Yeah, ma'am. Each sheet costs 50 rupees, ma'am.
Okay.
Even powder also costs 1,000 rupees and 2 to 3 months. Hello, ma'am.
Okay. I think you mentioned 1,000 rupees while your presentation, right?
Powder costs 1,000 rupees, ma'am, which can be used for 2 to 3 months, ma'am. So these are cost-effective things, ma'am.
Okay. And what's your take on other methods of chronic ulcer healings? There is a lot of research going on various methods about regarding the chronic ulcer healings. So, what is your take on that? Other methods except the silk form dressing?
Yes, ma'am. There are plenty number of methods like vacuum-assisted healing for venous ulcers, which have been used in our Usmania Medical College from very long time, ma'am. And there are hydrocolored dressings, and there are transparent dressings, and there are quite a number of lot of dressings, ma'am. But this even in including even in this silk protein also, I think in Karnataka there are few researchers or scientists which have found using the cocoons of the butterflies, even used as a form of a powder, ma'am. We can find it on the internet also. So I think a lot of research is going on
I
this
want to ask
areas, ma'am.
you are saying that Osmania University is undergoing lots of techniques, other techniques. Why did you choose specifically the silk form protein? Why not the other like vacuum dressings or platelet-rich plasmas or other methods which are now very in trend or rising? Any
As silk protein
specific
dressing is
advantage
very
you found over the?
no, nothing as such, ma'am. I discussed with our chief Mallikarjun sir and my PG, and we came to that conclusion, ma'am.
For silk
I
form
don't
dressing?
have that big idea.
Okay, okay.
Yes, ma'am.
And one more thing I wanted to ask that you had mentioned in your exclusion criteria about the platelet count. Why is it important? Like,
Yes,
why
ma'am.
did you exclude the patients who had platelets less than 1 lakh? Any contraindications for that?
Yes, ma'am. Not exactly like contraindications, but platelet thrombocytopenia, which acts as a confounder between these two things, ma'am. It can affect the wound healing process, and there might be a risk of I can't study error will increase, ma'am. So I want to exclude that confounding factor. So I excluded the thrombocytopenia thing and osteomyelitis and cellulitis and all other infections things.
Yeah, other infections, I got it. I just wanted to ask regarding the platelets. Was it why was it taken into the exclusion criteria? Okay,
Thank you so much. Thank you, ma'am.
Thank you for the nice presentation.
Thank you.
Next, we have Nishchal Zadeh. I'm sorry if I'm mispronouncing your name. Their topic is the impact of COVID. Next, we have Nishchal Zadeh. I'm sorry if I'm mispronouncing your name. Their topic is the impact of COVID-19 on attending resident doctors, a cross-sectional study.
Yeah, just a second, I'll share my screen. Is the screen visible?
Yes, Nishchal, it is. Are you ready?
Yeah, just a second.
Yeah.
Yeah.
Ready, Nishchal?
Should I start?
Yes, begin.
Yeah. Hello and good evening, everyone. My name is Nishchal Zadeh. I'm a third year MBBS student from batch 2019 from NKP Sarve Institute of Medical Science and Research Center and Lata Mangeshkar Hospital, Nagpur. My title of the research paper is The Impact of COVID-19 on the Attending Resident Doctors, a Cross-Sectional Study. Introduction. The COVID-19 pandemic has resulted in significant burden globally. Healthcare workers, being at the heart of the unparalleled crisis of COVID-19, face challenges treating the patient infected with COVID-19. The impact on the healthcare workers and creating atmosphere of COVID-19 included decline in their mental health and emotional exhaustion. Healthcare workers are often prone to burnout syndrome, higher levels being reported among the healthcare workers working in an emergency department as well as ICUs. Healthcare workers had to contend with a range of significant stress factors, including the risk of infection, workload changes, sleep deprivation, loss of colleagues, and sometimes providing care in less than adequate settings. Apart from their personal stress while working inside the wards and away from their family, they give their full potential to save the life of patient, but in return, sometimes they receive the physical violence from the patient. The objectives are of studies to study the impact of COVID-19 on the physical, social, mental, and academic health of the attending resident doctors. Materials and methods includes a study design, a cross-sectional study based on a questionnaire. Study setting includes the medical college in India. Study population is of COVID-19 duties attending resident doctors. Study period is of 2 months in 2021 in the year. And sample size includes the 99 resident doctors selected by simple random sampling technique. Plan of analysis was the cross-sectional study was carried out using the validated questionnaire mode among the resident doctors through the Google Forms. After the approval of Institutional Ethics Committee, all the responses were analyzed by using SPSS version 20 software. So here are the results. The emotional exhaustion was the most common effect of the burnout syndrome seen in the healthcare workers. And due to the disturbance in the sleep-wake cycle, it was the most common reason of feeling stress during the COVID duties. These are the academic effects. That is the 49 to 56 are they are the most common working number of working hours per week in the COVID-related areas, as well as the academics of resident doctors. They are drastically affected, mainly their studies. Social effects include the preferred ways to de-stress after COVID duties of the resident doctors were trying out their hobbies, as well as the effects of COVID duties on the families of resident doctors includes that their family is proud that they are rendering their services at the time of crisis, as well as some of them had also responded that their neighbors distance themselves from their family. These are the physical effects, including that main factors affecting physical health of resident doctors while doing COVID duties are the lack of proper sleep and important measures required to be taken to prevent getting attacked by mob when breaking bad news to COVID patients' relatives, where the hospitals should install CCTV at all sections handling the COVID patients, as well as adequate security staff should be presented outside the COVID wards. The 6 hours are the average duration of sleep during the COVID duties by resident doctors. The discussion is the COVID-19 pandemic has resulted in various crises at the global level. Resident doctors from the various medical institutes volunteered as the respondents for their study. Among them, 54.5% were the females and 45.5% were the males, and also 81.8% were practicing from private institutes and 18.2% were from government institutes. According to our study, we found that the resident doctors were affected mainly in 4 areas, including mental, academic, social, and physical. Amongst them, mental impact was the greatest of all. Due to the sudden increase in number of patients, the duties of every healthcare worker increased. Apart from their long-standing COVID duties, they also had to manage their academics. Hence, due to the lack of time, many difficulties were faced by them. It was observed that anxiety was associated with stress and reduced sleep quality. This, coupled with conflicting guidelines on the treatment of COVID-19 from various health agencies and government resources, collectively created an impact on an individual. A study by Kai et al. Measured the physiological and psychological impact of COVID-19 on frontline medical staff members and found that healthcare workers experienced anxiety about their own and their family's safety. According to our study, largest number of resident doctors worked 49 to 56 hours in a week. Among our healthcare workers, we found that resident doctors and nurses were most prone to burnout syndrome, followed by other staff. Studies suggest that negative work environment may account for not only burnout but also poor patient outcomes. Sleeplessness contributes to symptoms of depression and anxiety. And contrariwise, symptoms of depression and anxiety disturb sleep. So sleep disturbance are a standalone risk factors for suicidal behavior. Social stigma had also significantly affected the quality of life. Access to appropriate PPE remains of paramount importance to help physicians feel physically safe. Conclusion. COVID has put many deep scars of negative impact on resident doctors, but they worked seamlessly by looking at the bigger and positive picture beyond those circumstances. Increase in healthcare workers and arrangement of shifts with adequate time between the shifts where they can manage their personal life and can get proper rest, which aids to work with their complete potential and can also boost up the healthcare management.
5 minutes are up, Nishchal, so sorry.
Yeah, just a minute. To continue to provide uninterrupted quality care, the resident doctors must be empowered, encouraged, and counseled regarding self-care, time management, emotional regulation, and practicing few physical exercise in any form, along with maintaining their academic activities. These are my references, and this is the code. Thank you.
Thank you, Dr. Nishal. Topic is very good because the definition of health itself contains 4 parameters. That is the mental, social, physical, and now spiritual also. But you have taken one more, it's academic, right? My question is that how you assess the mental and social? Is there any questionnaire or is there any some?
Just a second, sir. Yeah. Yes, sir. Sorry.
You have assessed the 4 parameters: mental, social, physical, and academic, right?
Yes, sir.
So my question is that how you assess the mental and social parameters?
Sir, mental are their psychological, it includes the burnout syndrome of their.
Have you used some questionnaire?
Yes, sir. By the questionnaire format that Google Forms I had submitted.
In Google form, have you asked some questions?
Yes,
there
sir.
Are some questionnaire on mental health?
Yes, sir. It was the questionnaire.
Which questionnaire? Which questionnaire? Is there a reference?
Sir, yes, sir. It was the effect of burnout syndrome which are seen in the healthcare workers. Like we had asked them what may be the effect of burnout syndrome, and even the reason of feeling stress during their COVID duties, like during their long COVID duties, what may be their reason of feeling stress. And yeah, these were the mental
social determinants.
Yeah, social effects were that we had asked that even that after the long COVID duties, what were their preferred ways to de-stress their de-stress their workload, and another was that effects of COVID duties on families. What are the effect on their families about their COVID duties? Like some have responded that their neighbors have distanced themselves from their family members because their children were doctors. And another was the major group responded that their family were proud of them, that they were even rendering their services during this crisis.
One more question. You have taken the 99 sample, right?
Yes,
so all the residents of your own institute, or there are 3 to 4 institutes? Sample size, how you take 99 residents?
Sir, I just all over the India, all over the India, like a few colleges, I just spread the Google form, sir. And the resident doctors, there was no any age limit, sir. Only the their designation, what is the resident doctors, was mattered.
Okay. My last question, is there a more, all these 4 parameters, who are more sufferer, either female resident or a male resident?
Sir, it was a female resident because actually we had in our study there was more female resident who have responded. As I told that 54% were of the female responders and 45% were the male responders. So according to that, females were the more sufferers, sir.
Okay, okay. Over to you, Niranjana ma'am.
Good evening, Ms. Chal.
Good evening, ma'am.
Good study conducted during the COVID hours. COVID need, the need of the hour actually. I wanted to ask, you have mentioned in your objectives about 4 parameters, right? So
Yes, ma'am.
you did not mention anything regarding the effect of COVID on the academics per
Ma'am,
se.
yeah. Ma'am, I had like
How do you assess that?
yes, I had commented on that, ma'am. Academic effects, I had seen that a number of working hours per week in the COVID related areas about the resident doctors, because if their number, like their working hours are increased, then their like that will be directly affect on their consumption of their whole hours, and which will lead to decrease in their academic, their own self studies. So the first effect is this, and another is that academics of resident doctors affected. So they had also responded that it was drastically affected their subject study. Besides, they may have learned any practical studies like during any during their clinics, during their in hospital rounds, but their subject study had been affected drastically according to their self studies, like according to them.
Okay, so the responses or the questionnaire you used was mainly only for the self-study, or also which included parts of thesis or online classes or practical sessions which used to happen pre-COVID era? Did you include all these things in the questionnaire? Like the effect on their thesis, effect on their sample size, the topic which they chose for thesis, because COVID time, lot of thesis sample sizes got affected. Many people had to change their thesis topics also.
Yes, ma'am, but I didn't included that like particularly different topics, but I had like we can consider it in an academic effect, like because academics it includes all their thesis as well as their
I'm
subjects.
asking what all was the parameters in your academic part of assessment? Any questionnaire which you used, wherein what questions were used in the questionnaire?
Actually, the questions were overall regarding their hours which are affecting their self studies. As such, particularly thesis was not included, but
The
few
practical
open.
exposure and the clinical sessions which used to happen pre-COVID era.
Yes, ma'am, that had that may have affected, but in particularly by I didn't ask regarding that.
Okay, okay.
Yeah.
Okay, thank you.
Yeah, thank you, ma'am. Thank you, sir.
Next, we have Sana Javeria Badiruddin. Her topic is morbidity pattern among children residing in an urban slum of Aurangabad, Maharashtra.
Yeah, I'm here. Give me a second. I'll share my screen.
Yeah,
Can you hear me?
Yeah, we can hear you.
Okay, so I'm presenting through my phone, so please bear with me. Sure thing.
Yeah, we can see your screen.
Okay. Thank you for informing. So my name is Sana Javeria. I'm a third major student from JIIU's Indian Institute of Medical Science and Research, Jalna, and my topic is study of morbidity pattern and malnutrition pattern in children residing in an urban slum of Aurangabad. So just to brief you all, this study was a part of a project through which we are trying to highlight and solve the health and educational needs of slum kids. So according to NFHS, Maharashtra has a total population of 22.8% of children below 15 years of age. And this is a very critical period, and in which children are more susceptible to various conditions like stress, infections, and malnutrition. So providing proper nutrition to them and preventing them from exposure to various diseases is a big task, especially in slum areas. We performed the study in Misirwadi, which is a slum area near Aurangabad, with total population of 20,000 approximately. The population of kids in that slum is near around 7,000, and this is one of the most underserved areas in Aurangabad. Our objective was to assess the morbidity pattern and malnutrition in children living in that slum area and install the required health interventions. So, materials and methods. Misirwadi has a total population of 7621 in the age group of 0 to 18 years. Simple random sampling technique was used. 300 children were enrolled in the study. Required sample was 261. Pre-designed questionnaires were used in the study. For anthropometric measurements, we used Salter scale for weight measurement and measuring tape for height measurement. WHO growth standards were used, and data was entered and analyzed by using t-test and chi-square test with a p-value of less than 0.05. Now here are the results. So this study included 170 male children with mean age of 10.1 years, and similarly female children with mean age of 8.78 years. The commonest morbidity that we found was malnutrition, means out of 300 children, 81 were malnourished, that is 27%, which is followed by dental caries, ARI, viral fever, eye problems, worm infestation, and diarrhea was also common. So this is a graphical representation of the morbidity pattern that we obtained in that slum area. And we can clearly see that malnutrition is paramount morbidity there. The overall prevalence of malnutrition among children was found to be 27%. And we found the commonest type was grade 1, followed by grade 2 and grade 3. We found that there were least number of children who were obese or overnourished. Now to conclude, morbidities were found to be higher in female children than male children. It was near around 32.33% as compared to male children, which was just 20.66%. And it was higher in the age group of 0 to 5 years than other age groups. There is a need for regular health checkups and treatment of these children with special attention to the needs of female children. Also, economic rehabilitation, incentives to the family, sanitary living conditions, and dietary supplementations are some of the important interventions that are needed to improve their quality of life. Finally, Healthy Misirwadi is our dream, and this is a project that we are running, and kids are the future. So this was all about my quick presentation. Thank you.
Thank you, Dr. Sana Zaveria. You are
Yes, sir.
presented very nicely. Just show your slide materials and methods.
Okay, sir. Yes, sir.
Okay. Before that, just aims and objective prior to one.
Yes, sir. How is it?
To assess the morbidity pattern and malnutrition, right?
Yes, sir.
So morbidity pattern and malnutrition. So malnutrition doesn't come in the morbidity. This is something different.
Sir, it comes under morbidity, but we actually
Then how you
perform
put to assess the morbidity pattern and malnutrition?
actually, we wanted to highlight malnutrition as well in the study because it's a very disastrous condition that we have in the slum children's. So we highlighted both the points separately, morbidity and malnutrition.
Okay. It is a published article?
Yes, sir. Yes, it has been published yesterday only.
Okay, it has been published yesterday. Okay, next is you have mentioned it's how much that 0 to 18 years, right? And you have
Yes,
taken a 300
sample.
How you the 300?
So actually, as I said, we are running a project. So we conducted a survey camp, general health survey for children, in which we announced that the children who are suffering from any kind of disease, they should come to us and we will assess them. We had a pediatrician with us and a student group of students. And we
My question is that how
we
you
enrolled
300?
We enrolled students who were kids who were coming, and we found that 300 children were like enrolled in a study and visited to the campaign. We included all of them, though the sample size was 261.
Okay. This is which type of study this is?
Yes, sir.
Which type of study?
It's a survey-based study.
Survey-based study. Okay, ma'am, over to you.
Hello, Sana.
Hello.
I just wanted to ask in the aims and objectives, can you just go back to the aims and objectives slide?
Yes, ma'am. Yes.
Yeah. You have mentioned that in the aims to install the health
Interventions.
required health interventions. So I just wanted to ask what all was done after.
Actually, ma'am, we are processing over it. We had arranged many health campaigns in that slum area. We had arranged pediatricians and skin doctors, and now we have treated almost around 70% kids. And we are coordinating with government schemes, government organizations and NGOs, health NGOs, who are funding us, and we are installing various hospitals and treatment facilities there.
Okay, so is it limited? That is, whatever you are giving as an result of this survey, is it limited to the sample size of 300, or even more children are getting enrolled to it?
We have actually provided token to the families and children, and now we are continuing a study, and in the next year we'll be publishing the similar kind of study with the sample size of 2,000 children. Sorry.
Okay, so the study is still ongoing for the next year.
Yes, ma'am. This is one study that I started with, and this will be continued.
Okay. And any similar Indian studies which has been published, of which you have taken
yes,
any
ma'am, there are certain studies. Yes, there are certain studies. One is in the Bengal, and another one is done in Assam region, which I didn't add in the references. Sorry.
Okay. Okay, Sana. Thank you.
Okay, thank you.
All right. Next we have Gopu Anthony Reddy. Their topic is efficacy of platelet-rich plasma in the treatment of chronic non-healing ulcers. Are you here?
Yes, I'm here. You can hear, right?
Yeah.
Yeah,
Please
I'll
go
share the
ahead.
screen. Hello. Some technical issue. Let me do it.
Yeah, sure. Please take your time.
Correct.
Anthony, would you like to present after a while till you sort out your technical issue?
I think one of the jury members has also exited because of an error. So,
Should I move on to the next?
just give us a minute, maybe. Just a minute.
Hello. Hello.
Yeah, Anthony.
Yeah, sorry for the connection.
Yeah.
You can see the screen, right?
Yeah.
Yeah. Good evening, everyone. This is Anthony Reddy from Kakatiya Medical College, Warangal.
Anthony,
The topic,
start
yeah,
the slide.
you can see,
Yeah, press the play button.
okay.
Yeah, go on.
Yeah, the topic for my today's paper presentation is the study of efficacy of platelet-rich plasma in the treatment of chronic non-healing ulcers, a prospective interventional study. Chronic non-healing ulcers are debilitating and have a significant impact on the patient quality of life, compromising his sleep, mobility, and work capacity. Chronic ulcers management is challenging because the moist environment required for the formation of granulation tissue also favors bacterial growth. PRP is an endogenous therapeutic technology for chronic ulcers. It is defined as autologous biological product derived from the patient's own blood, in which after a process of centrifugation, a plasma fraction is obtained with a platelet concentration higher than the normal circulating blood. There are several growth factors which are involved in the wound healing process, in which platelet-derived growth factors plays an important role. PRP accelerates endothelial, epithelial, epidermal regeneration, stimulates angiogenesis, enhances collagen fiber synthesis, promotes soft tissue healing, decreases dermal scarring, enhances hemostatic response to injury, and reverses the inhibition of wound healing caused by glucocorticoids. The high leukocyte concentration of PRP has an additional antimicrobial effect. Our study primarily aims to assess the efficacy of platelet-rich plasma in the ulcer healing by evaluating the percentage reduction in ulcer size over the 8-week follow-up period by visual inspection, and secondarily to assess the safety and feasibility of autologous PRP injections and the time required for ulcer healing. After a proper institutional ethical clearance, a non-randomized prospective interventional study was conducted in the Department of General Surgery for a period of 5 months from 2019 November to 2020 March. And the study included the patients coming to surgery outpatient department with chronic non-healing ulcers of various etiologies and patients more greater than 18 years old having chronic ulcers were analyzed. We included the ulcers of more than 6 week duration, clinically non-infected and full thickness without the exposure of bone, muscle, ligaments or tendons. Patients above 18 years of either sex, normal blood test results in terms of platelet and RBC counts and hematocrit, and the ulcer size equal or less than 30 centimeters square and patient with negative hepatitis B and HIV. We excluded the patients with bleeding disorders, uncontrolled sugar levels, ulcer with active infection, saphenofemoral junction incompetence, area of the ulcer greater than 30 centimeters square, and systemic diseases history of anticoagulant, immunosuppressive or antibiotic therapy in the last 3 months. After a proper inclusion and exclusion criteria, a total of 36 cases of chronic ulcers of various etiologies were included in the study, and one patient lost the follow-up. All the patients were treated with the PRP therapy and followed up at weekly intervals till 8 weeks, with PRP application for maximum of 6 sittings. Area of the ulcer with respect to the initial area and the percentage reduction, that is healing of the ulcer, was assessed at each of the follow-up visits. We found that out of the total 36 patients, the mean age of the study participants was 51 years, and 72% of the study participants belonged to the male genders and rest were females. This is the age distribution of the patient with chronic ulcers, and the percentage reduction in the ulcer area in first week was 15%, and in the sixth week was 96%, with statistical significant difference from the baseline. Complete healing of the ulcer was observed in 72% of the subjects at the end of 6 weeks and became 88% when followed for extra 2 weeks. Among healed patients, 3 subjects had shown complete healing at the third visit itself. One second.
4 minutes are up, Anthony.
One second. I cannot share the screen properly. We use a butter paper for recording the size in the weekly intervals, and we conclude that the autologous PRP therapy is a reliable, cost-effective intervention for patients with chronic ulcers associated with impaired healing. Good patient compliance and satisfaction were seen as there were no problems with application and no complications were reported. Sorry, I cannot share the screen beyond that. I don't know why.
That's all right. That's all right.
Yeah.
Are you done with your presentation?
Yeah.
Then?
Yes. Thank you.
I guess the jury members can ask their questions too.
ऐसे बोला था एक पेशेंट का हिस्ट्री लेने को एवरी सैटरडे मतलब एक पेशेंट को प्रेजेंट can you mute yourself? हाँ जी मुझे बोला कल सैटरडे के मैं आ गई वापस छुट्टी के लिए फिर मुझे आता है कल प्रेजेंट करना है मैं तू है.
Hello.
Yeah.
Yes.
Ma'am, do you have any questions to Anthony?
Yes, Anthony, I wanted to ask you that how was this PRP administered?
In the form of injections, ma'am.
Okay, and what is the costing?
As it is an autologous therapy, it's done generally free of cost at hospitals, ma'am. Like
Okay.
in our hospital, we have taken the patient's own blood and made a centrifuge process and obtained the platelet concentrations. which is higher than the normal circulating blood.
Okay, okay. And what was the rate of infection in them post the application of PRP or anything?
Ma'am, rate
Like
of?
infection. Any infections?
No, ma'am, we didn't find any infection, ma'am. Like there are no complaints from the patients also. There after report, and there were no complications after application.
Okay. Any limitations of your study?
The only limitation is we cannot compare with normal dressings, ma'am. As it is a prospective interventional study, like we cannot compare it with the normal dressings, conventional
Do you
dressing.
know any other uses of the platelet-rich plasma?
Ma'am,
Do you know any other uses of the platelet-rich plasma other than the for chronic non-healing ulcers?
it also
The
has
other
some hemostatic response to injuries.
Okay.
It also stimulates blood vessels like angiogenesis process.
Okay. And was there any standardization method for the extraction of the PRPs and the protocol for giving them? Have
No,
you
ma'am.
compared it with another study? Did you take any reference for standardization and the protocol for giving the injections?
Yes, ma'am. We have taken the references from the previous studies, and we have done it.
Okay. Okay, sir.
You have mentioned your study design is non-randomized prospective interventional study. Which
Yes, sir.
intervention you have done?
So application of PRP and looking for the specific outcome, like checking for the ulcer size reduction, sir.
So
Actually, I need to show the sequential images, like in weekly, but I don't know why it is not sharing.
Okay. Even you have not mentioned your study period and study.
Yes, sir. Here I forgot to mention, sir, but actually it was of 5 months duration, 2019 November.
It has to be mentioned. Study period is very important.
Yes, yes, sir.
Even study sample size, you have taken only 36 patients, na?
Yes, sir. 30.
On what basis?
Sir?
Justify your 36 sample size.
We have taken the purposive sampling method, sir. Like we have in the duration of 5 months, as there are a criteria for inclusion and exclusion. So we have got only those patients in the duration of 5 months.
Okay, thank you. Next.
Thank you, sir.
Anthony, one more question I wanted to ask.
Yes, ma'am.
I think you have two aims and objectives, right? Can you just go back to the aims and objectives?
Okay, okay, ma'am. Yes, ma'am.
Yeah, here you have mentioned to assess the safety and feasibility of the PRP injections.
Yes, ma'am.
You have mentioned about the time required for the ulcer healings in your results, but like safety and the feasibility of PRP injections, there is no comment regarding that. So, any you missed it or?
Yeah, yes, ma'am. Like we didn't found any complications reported by the patient. So
Okay, so just to mention it in the conclusion because when it is in your aims and objectives, the
yes, ma'am.
conclusion.
In the conclusion, ma'am. Like while I'm saying, I told that also. Good patient compliance and satisfaction were seen, and there were no problems with application and no complications were reported, ma'am.
Okay, okay. Okay, thank you.
Thank you, ma'am.
Now we have Azmira Prakash. Their topic is the role of diagnostic laparoscopy in doubtful abdominal and pelvic pathologies to avoid laparotomy.
The participant is not there.
All right, we'll move on to the next. Shri Meghna Kankipati, a cross-sectional study of surgical site infections in a tertiary care hospital.
Hello? Yeah,
Hi,
just a
yes.
minute. And
Yeah.
is my screen visible? Hello?
Not yet. Yeah, now it is. Go ahead.
Yeah. I'm starting. Thank you. Good evening, everyone. I'm Sri Meghna Kankupati, third year MBBS student from Andhra Medical College, Vishakhapatnam. And my topic was a cross-sectional study of surgical site infections in a tertiary care hospital, Vishakhapatnam. Introduction. Wound infection is the commonest and the most troublesome disorder of wound healing. The infection in a wound is manifestation of the disturbed host bacteria equilibrium that is in favor of the bacteria. Previously, up until mid-19th century, in cases of deep or extensive infections, this resulted in a mortality rate of 70 to 80%. Most of the SSIs are superficial, but even so, they contribute greatly to the morbidity and mortality associated with surgeries. In the year of 1992, the US Center for Disease Control revised its definition for wound infection by making it as surgical site infection. CDC splits the SSIs into three groups: superficial, deep incisional SSIs, organ space SSIs. A system of classification for operative wounds that was based on degree of microbial contamination was developed by US National Research Council group in 1964. Four wound classes with an increasing rate of SSIs were described: clean, contaminated, and dirty. Risk factors for acquiring infections are host factors, surgical and environmental factors, and microbial characteristics. Staphylococcus aureus is the causative agent in 15 to 20% of the infections. Many studies have shown the incidence of infection is directly proportional to virulence of the microorganism. Objectives: identify the etiology of surgical site infections, evaluate the frequency and clinical presentation of SSIs, evaluate the common risk factors for SSIs. Methodology: a cross-sectional study has been carried out to know the incidence of SSIs in Andhra Medical College, Vishakhapatnam. The study was conducted from May 18, 2022 to August 18, 2022. The biodata of the patients, together with their presenting features, diagnosis, type of surgery performed, was noted, and data was analyzed using Microsoft Excel computer program. Chi-square test was used to test the statistical significance of the results. The study population was recruited after fulfilling the selection criteria from general surgery department. 120 patients were selected using randomized technique. Minor surgical procedures were not considered, and procedures in which wounds are left open and operations on ulcers were excluded. Inclusion criteria: patients with age above 15 years, patients of either sex, patients who underwent clean contaminated surgeries electively, and contaminated and dirty surgeries in an emergency. Exclusion criteria: refusal to participate in the study, patients undergoing reoperation, patients who failed to come for a follow-up of up to 30 days since the day of operation. Results: the overall incidence of SSIs in the study was shown to be 11.6%, and these are the individual prevalence rates of each type of surgeries. Results of wound culture. From the results, it was shown that Staphylococcus aureus have shown to have the most of the prevalence here. Risk factors: age and sex. Age of more than 50 years showed to be a risk factor for SSIs. The incidence of SSI were more in male patients compared to female patients. Males show a prevalence rate of 15 to 15%, and females show 7.407% prevalence. Weight and height. Quitlet index of more than 40 was identified as a risk factor for SSI. Anemia. It was noted that SSI were more common in patients who had low HB levels preoperatively. The more the anemia was, the more was SSI incidence. Duration of surgery. The rate of SSI were more in surgeries that lasted for more than 150 minutes. Other risk factors included surgical procedures, preoperative patient care, staff, theater design, and planning equipment. The infection rate was observed to be higher in contaminated and dirty operations. The incidence of wound infection in emergency was about 2.46 times higher than in elective operations. The SSI rate in non-diabetics is 10.86%, whereas it is 33.33% in diabetics. It is observed that when drains were not used, the infection rate was 6.13%, and it was 25.37% when drains were used. Conclusion: in spite of modern surgical and sterilization techniques and the use of prophylactic antibiotics, post-operative wound infections pose a great threat for the patients in terms of mortality and morbidity. The SSIs are more in males as compared to females. Male is to female ratio was usually 3:1 in SSI patients. The common risk factors included ill nutrition, obesity, presence of infective foci, diabetes, hygienic conditions, and the duration of the surgery. The improper and prolonged use of antibiotics should be avoided, as this can lead to development of resistant strains of microorganisms, which can lead to nosocomial infections. This study established the influence of nature of the surgery, duration of the surgery, anemia, diabetes, and the use of drugs on the incidence of the infection, with a strong statistical association. And these are my references, and thank you.
Thank you, Dr. Srimegha Kankitpatti. Your presentation is very nice. My question is, just show your objective slides.
Yes, sir. Yes, sir. Yes.
You have three objectives, right? To identify the etiology, to evaluate the frequency and clinical presentation, right? And to evaluate the common risk factors.
Yes,
and
sir.
we just go to your result section that you have mentioned age and
yes.
sex something.
Yes, sir.
First one, age and second. Next. What is this age and sex? But you have mentioned only male and female. There is no areas in this table.
Yes, sir. I didn't get it.
Your table is showing only gender, na? There is no age. But your title
Actually, yes, sir. Actually, here we didn't show the age, but we took age also into consideration, sir. And it showed actually both the extremities of the age showed to have a high prevalence rate. Like the neonates and the old age persons showed to have more prevalence, sir.
Okay. One more thing, you have taken a sample as 120.
Yes, sir. Yes.
Right? How justify your 120 figures? How it comes?
Actually, it was we took it in a randomized technique, sir. We actually called the cases which we got in both elective and emergency cases, and out of them we used a randomized technique, and we took out 120 cases, sir, in those period of time in which we undertook the study, sir.
And you have mentioned the SSI is more in the males. That is a 3:1 proportion, right?
Yes.
What will be the reason? Probable. Why the males are more?
Yes. Because males are more prone to exercise because they tend to interact with the atmosphere more compared to females, sir. Like they go to occupational areas and occupational hazards are more prone to them. So the environmental factors play a major role for males to get more exercise than females, sir.
Okay, thank you. Over to you, Niranjana ma'am.
Good evening, Sri Meghna. You have nicely covered almost all my questions. Yeah, you have almost covered all the questions which I wanted to ask very nicely. Right? So, no more questions from my side. Thank you. Hello? Can I stop sharing my screen? Can I stop sharing my screen?
Yes, Meghna, you can. Thank you.
Yeah, thank you.
Moving on, we have Vinisha Soumya. Their topic is Novel Cardiac Pacing Biomodel in Small Mammals. Are you present, Vinisha?
Seema, I don't think she is.
Okay, next we have Romana Riaz. Their topic is a meta-analysis study on effectiveness of hyaluronic acid and retinol oil used in reducing the appearance of fine lines and wrinkles. Please go ahead, Romana, if you're here.
Hello, am I audible?
Yeah, you're audible.
I'll share my screen. Can I start?
Yeah, please go ahead.
Respected judges and my dear colleagues, I'm Romana Riaz, an intern from Shahjan Institute of Medical Sciences, Hyderabad, India. Today I would like to present on meta-analysis study on effectiveness of hyaluronic acid and retinol oil used in reducing the appearance of fine lines and wrinkles. The contents that I'm going to discuss are introduction, hypothesis, methodology, results, and conclusion. Introduction. As we know, skin is the largest organ in the human body in terms of surface area and weight. It covers the entire external surface of the human body. Then skin is divided into epidermis, dermis, and hypodermis. Then epidermis is further divided into 5 layers, and skin plays an essential role as the first physical and biological barrier. It also aids in retaining moisture and maintains internal homeostasis. The skin also serves as a myriad of vital functions such as sensation, protection, storage of lipids and water, immunological surveillance,
Your slide
secretion,
is
and
not
thermoregulation.
just there.
Yes, sir.
Please play your slides. Go ahead, na. Your first slide is showing on that. So. Please change your slides also, na. Yeah.
Okay. So on slideshow is not visible.
No, it's not on slideshow.
No, it isn't.
Okay. So I'll go with this. Okay. So the contents which I'm going to discuss with you all are introduction, hypothesis, methodology, results, and conclusion. Here, introduction, I'm discussing about skin. So as we know, skin is the largest organ of the human body in terms of surface area and weight, and it covers the external surface of the human body. The skin is divided into epidermis, dermis, and hypodermis. Then epidermis is further divided into 5 layers, and skin plays an essential role as the first physical and biological barrier to the external environment to prevent the entry of foreign particles. The main function of skin is it helps in aiding in retaining moisture and maintains internal homeostasis. The skin also serves as a myriad of vital functions such as sensation, protection, storage of lipids and water, immunological surveillance, secretion, and thermoregulation. Intrinsic aging. The aging process is by intrinsic factors and extrinsic factors. Here, the intrinsic aging is physiological and it is genetically determined process that results in wrinkles, dry and itchy skin, expression lines, as well as hollow cheeks and eye sockets. Whereas extrinsic factors, as we all know, the environmental triggers about 80% of cutaneous aging, and environmental factors mainly are by the UV radiation and the lifestyle habits like drinking, smoking, chronic stress, and unbalanced diet. Here you can see the structure of hyaluronic acid and retinol. So hyaluronic acid is a non-sulfated glycosaminoglycan that is composed of repeating linear polymers of disaccharides of D-glucuronic acid and N-acetyl D-glucosamine. Both are linked by glucuronic beta bond. And hyaluronic acid is produced by fibroblasts, keratinocytes, and chondrocytes and synthesized by enzymes called as hyaluron synthase. And it is degraded by hyaluronidases and cellular oxidation by UV radiation. So the main function of hyaluronic acid, it is naturally found in the skin connective tissues, and it retains the water to maintain appropriate skin moisture, and it helps in prevention of wrinkles and fine lines. The hyaluronic acid structure does not consist of cross links. It has short half life and has very low side effects. Whereas retinol is a derivative of vitamin A. It is a fat soluble vitamin, and it is not produced naturally by the body. The role of retinol is it contributes to the proper distribution of melanin in the skin. It leads to reduction in depigmentation in the skin. Retinol also has been proven to stimulate the production of hyaluronic acid in the epidermis by inducing gene expression. Retinol is applied topically, and the peeling is caused by an increasing in retinoic acid receptor. Here, the main hypothesis of our study was to know that how hyaluronic acid and retinol are effective in preventing and treating the wrinkles. The methodology, as it is a meta-analysis study, we have gone through several articles, around 11 articles that included only adult population in the study with no gender restriction, no language restrictions were imposed. The age and year filter was used, and articles from the 10 years were considered from 2011 to 2021. So here are the 11 articles, out of which 5 articles were based on hyaluronic acid and 6 articles included retinol oil. So the 5 articles were 4 from clinical studies and 1 was single central randomized double-blinded trial, whereas the 6 articles, out of which 2 clinical studies were taken. 1 was double-blind vehicle control study, double-blind vehicle study, a randomized control parallel trial, and another one was randomized placebo control study. So you can see here Out of these papers which we have chosen, the results shown were hyaluronic acid when used in injectable forms reduces wrinkles in less time as compared to the topical application. And it was found that topical application reduced wrinkles after 8 weeks, while the same effects were observed by injectable hyaluronic acid after 5 weeks. Now, when comparing to the retinol oil, all these results of retinol oil significantly reduced wrinkles and fine lines. Improvement in wrinkles was seen even after the 4 weeks of cessation of applying these products. The conclusion here in this various studies analyzed, it is proven that topical application of hyaluronic acid improves the appearance of fine lines and wrinkles by maintaining its role, while retinol is effective by increasing the collagen production and decreasing its degradation by metalloproteinases as a result of age and sun exposure. Limitations here, the limitations were, as we when we were going through the literature review, we found that most of it was mainly discussed for the females, and the maximum follow-up mentioned was up to 52 weeks. And here we expect some improvements and areas of improvement in future studies. References. Thank you.
Thank you, thank you, Dr. Roman Riaz. Your presentation is very nice because it's a meta-analysis study, correct? To see
Yes,
the effectiveness of hyaluronic acids and retinol oil. My question is, your author is also one is from United States and one is from Malaysia, right?
Yes, sir.
So this study, that meta-analysis, you have done by you only, or the people that were sitting
No,
in Malaysia
sir.
or United States?
Yeah, we are actually, I'm a part of one research club, so we all contributed to this study. We divided our roles and we did the paper.
Okay. You have taken the 10-year study from 2011 to 21 also, right?
Yes,
And
sir.
you have mentioned there are 5 studies and 6 studies, right? 5 articles from the hyaluronic acids and 6 articles from the retinol oil, right?
Yes, sir.
So my question is that your title is to prevent and treating the wrinkles and fine lines, right? So
Yeah.
which is more, retinol oil is or hyaluronic acid? Which one is the greatest role to prevent and treating the wrinkles?
Hyaluronic acid, sir, as per our study.
Okay. And second one, the most of the studies have been already done in the females other than the males, right?
Yes, sir.
Yeah, right. Most of the studies have been taken by the females rather than the males. Okay, nice. Over to you, ma'am. Niranjana ma'am.
Thank you, sir. Good evening, Romana.
Good evening, ma'am.
A question you mentioned in a slide wherein you mentioned that the injectable form is more efficacious, right? If I'm not mistaken.
Yeah.
Is it right? Injectable hyaluronic acid is more effective on wrinkles.
Yes, ma'am.
Okay, so any side effects was of hyaluronic acid as an injectable?
Yes, ma'am. It is according to the time period of usage. For example, if you're using it for certain weeks, then mild bruising, erythema, and itching infections can happen. If it's for being used for like years, then there might be scarring and inflammation, like granulomatous inflammation can occur.
Okay, but in your conclusions, I think you have mentioned that the topical hyaluronic acid is better. So, isn't it contradicting that you have mentioned both the things? Hello?
Yes, ma'am. Topical application reduce wrinkles after 8 weeks, whereas injectable, due to its higher absorption, the effects, you see the is
Can
like
you just give
effect.
us your conclusions slide?
Yes, ma'am. Topical.
Yeah. Yeah, that is what in the conclusion topical is mentioned, right?
Yeah.
Yeah, that is what I wanted to ask because injectable was effective in 5 weeks.
Yes, injectable definitely it will be it gives faster results.
So you did not include that in your conclusions, or it was just a topical application comparison that you wanted to do?
Yes, ma'am. You're right.
Okay, okay. Okay, thank you, Romana.
Thank you so much.
Following up, we have Mrinalini Devi GKB. Their topic is correlation between cardiac valve integrity and disease activity in vitiligo.
Good evening, everyone. Is my screen visible?
Yeah, you can go ahead.
Yeah, and I'm sorry, there's a bit of rain here, so I'm not sure if my video is visible. Is my video visible now?
Yes, Brunalini, it is.
No, it's
You can go.
Please go ahead.
I'm sorry?
Please go ahead.
Okay.
It's visible.
Okay, thank you so much. Good evening, everyone. I'm Dr. Mrinalini Devi, and I'm here to present our study on the correlation between cardiac valve integrity and disease activity in vitiligo. I'd like to thank my guide, Dr. K.R. Sandal Kumari ma'am, for helping me through this journey. Vitiligo, as we know, is an acquired condition resulting from the progressive loss of melanocytes, affecting nearly 0.5 to 1% of the world's population. Various studies have detected antibodies directed against normal melanocyte surface antigens in majority of patients with vitiligo, and these studies have shown that these antibodies are selective to melanocytes and do not affect other cells in the human body. Melanocytes, as we know, are pigment producing cells present in the skin, choroid and iris of the eye, and inner ear in humans. Melanocytes in the inner ear regulate the endocochlear potential, and hence brainstem auditory evoked potential has been found to be abnormal in patients with vitiligo. Similarly, the visual evoked potential has also been found to be abnormal in vitiligo patients. In mice, however, the melanocytes have been found in the atrioventricular valvular structures of the heart, which led us to think, what if the cardiac valves are involved in patients with vitiligo who have a loss of these melanocytes? Which led us to objectives of our study to determine whether there is any structural abnormality of the AV valves, to detect the presence of any functional regurgitation, to evaluate the disease activity in vitiligo patients, and to correlate the cardiac findings with the disease activity. We started off by getting ethical committee approval, recruited the participants and made the necessary exclusion, got written informed consent, and then started to collect and analyze the data and do the necessary conclusions. Our study was a cross-sectional study consisting of 25 previously diagnosed vitiligo patients attending the dermatology OPD in our hospital. The study lasted for 6 months, and the inclusion criteria included patients with both sexes with generalized vitiligo and age less than 60, and the following exclusion criteria. To view the heart, we used a two-dimensional echocardiogram in which the mitral and tricuspid valve structure and function were analyzed in real time and stock frame images in the parasternal long axis and the apical view. To study the disease activity, we used two scales. The first scale which we used was VIDA scale, which is nothing but vitiligo disease activity score, which is based on the most recent episode of depigmentation that the patient has experienced. And the second score which we used was VASI score, which is the vitiligo area severity index, which is based on the percentage of depigmentation that is present throughout the body. Coming to the results, here we see that out of the 25 patients, 6 of my patients had mitral valve prolapse of the atrial mitral leaflet, and all 6 of the patients had a VIDA score of 3 or more, which means that they had a recent episode of depigmentation within the last 6 months. Similarly, 4 of the patients had trivial mitral regurgitation, and all 4 patients had a recent episode of depigmentation within the last 6 months. Coming to the VASI score, here we see out of the 6 patients who had mitral valve prolapse of the anterior mitral leaflet, 5 of them had a body surface area involvement of less than 3%. And all 4 patients who had trivial mitral regurgitation had a body surface area involvement of less than 3%. The mature atrioventricular cardiac valves are composed of 3 components: the extracellular matrix and valvular interstitial cells and the overlying endothelium. The mechanical requirements of the heart valves are due to the ECM composition, whereas the cells of the valve interact with the ECM in times of stress to undergo remodeling. It has been shown that melanocytes express and secrete metalloproteinases, and these metalloproteinases are involved in cardiac valvular remodeling. And considering how there's an acquired loss of melanocytes in vitiligo patients, the AV valve could be disturbed, and this is probably what led to the mitral valve prolapse. The prevalence of mitral valve prolapse is around 1 to 2% in the population. In our study, we found an increased prevalence. Through our study, we'd like both vitiligo patients and the treating physicians to be aware that vitiligo is a systemic disease that requires a multidisciplinary management. Future aspects for this study would be that all previous studies were conducted only in mice, where they microscopically analyzed the cardiac valves. Such an intervention was not feasible in living patients, which was why we used an echocardiogram. I would like to follow up these patients with valvular abnormalities so that they don't end up any complications. And further studies with a larger patient population are obviously required to fully understand the pathogenesis behind the mitral valve prolapse in vitiligo patients and to confirm its relation. These were my references. Thank you.
Thank you, Dr. Monali Devi. Your presentation is very nice.
Thank you, sir.
My question is that you have taken only 25 patients, right?
Yes, sir.
Do you justify how you have taken only 25?
Yes, sir. From the tertiary care hospital that I was studying in at that time, I was only granted permission to do the study for 6 months, and those were the only number of people I could recruit, sir. Because of my exclusion criteria, the place near our college is pretty rural, and almost everyone there is either a smoker or an alcoholic. So I had to exclude so many of my patients so that I could get so I could fulfill my exclusion criteria.
Okay, that is your universe sample. Whatever you have collected your duration of the study period, 6 months, right?
Yes, sir.
Okay. Second, it's your cross. You have mentioned cross-section study, right?
Yes, sir.
And every cross-section study has its own limitations.
Yes, sir.
So, what is your limitation of your study?
I'm sorry, sir. What is
limitation of your study?
Sir, first would be the sample size, sir. Obviously, a larger sample size would be required. And I limited my age group to only up to the age of 60, sir. That would be another limitation. And duration of the study, sir.
Okay.
It would be.
Yeah. And one more question. You have mentioned you have studied mice. My question is that is there any difference between mice heart and human heart?
Sir?
Mice heart and human heart?
Yes, sir. I'm sorry, sir. I couldn't hear your question properly.
Your last slide. Just your last slide.
Yeah. Yes, sir.
Since previous studies were conducted only in mice, right? So my question is there any difference between mice and human heart?
Yes, sir. So the way that I came across this idea was that I was looking up, I was reviewing literature, sir, when I found articles saying that vitiligo is a systemic disease. At the same time, I found an article, quite a few articles, which were using mice in developing artificial valves for humans. So they were using it as a prototype. They were trying different things in valves of mice so that they can develop a similar model in humans for prosthetic valves and artificial valves, which was when they found out that melanocytes are really important in maintaining the stiffness of the valves.
Okay. Ma'am, over to you, Niranjana ma'am.
Thank you, sir.
Yeah. Hello, Mrinalini. Yeah, I wanted to ask that what was the age of the patients where the volleyball complications came out to be positive?
The patients who came out to be positive, ma'am. They were on my study. It was all over the place, ma'am. The average age was 38, ma'am. Those who became positive, which was very close to the average age of my patients, ma'am.
Okay. And your exclusion criteria excludes the patient with previous cardiac disorders and everything, right?
Yes, sir. Yes, ma'am.
So what is the most common cause of mitral valve prolapse as such?
Ma'am, it could be either that it's just congenital, which they're born with, or it could be due to rheumatic heart diseases.
Yes, the same. I wanted to come to the same point. In rheumatic heart diseases, generally there are vegetations, right?
Yes, yes, ma'am.
So are these vegetations the reason for your for the mitral valve prolapse in your patients? Like, could you find any vegetations?
No, ma'am, there were no vegetations in any of the patients, ma'am.
Okay, it was not suspected because I think you did a transcutaneous 2D echo, right? It was not a transesophageal 2D echo.
No, ma'am, it was a transcutaneous, ma'am.
Transcutaneous. Yes. Okay. Okay. So, how could you relate, because the relation of the cardiac valve diseases with vitiligo is very less, as you mentioned. So, is it a possibility that the patients who came positive in your study can be because of other reasons like familial history of cardiac diseases, or yeah, because you mentioned that the surface area of the patients who came positive was also less, like less than 3% or something.
Yes,
I think you mentioned, right?
yes, ma'am. Yes, ma'am.
So there's a possibility that there can be a reason other than vitiligo also for
Yes,
this
ma'am.
finding.
Yes, ma'am. There can be, ma'am, which is why we need to increase the sample size, ma'am. But given the time period that I was able to do it, that's all I could get, ma'am. Being an undergrad, that's all I could do, ma'am.
Okay, but you have done good. Don't worry.
Thank you, ma'am.
Thank you.
Thank you, ma'am. And I'd like to thank the organizers for giving me this wonderful opportunity.
Madam, we have one more presentation, madam. Number 2.
Yes, ma'am, we have the last presentation.
So lastly, I'll call Dr. Prashant Upadhyay. Their topic is a study to assess and compare prescription pattern and appropriateness of antimicrobial use in a rural government tertiary hospital in India, Uttar Pradesh.
It is number 2 in the list, madam. Yeah, Prashant, go ahead with your presentation. Prashant, are you there?
Hello.
Yeah, Dr. Prashant,
Hello.
please go with your.
Yeah. Sorry for the delay. Actually, I am traveling right now, so that's why.
Yeah, please go ahead.
Just let me know my screen is visible or not.
Yeah, our screen is visible.
Okay. So, very good evening to all the respected judges and my colleagues. Sorry for the traveling in.
Nishant, your voice is very disruptive. Hello? Moderators, is it only for me or?
No, ma'am. I think there is an issue. Dr. Prashant, is there like an internet problem from your end? Dr. Prashant?
I think he's disconnected.
Yeah, just wait.
Yeah.
Prashant, can we do one thing? You can send me the presentation to me. I will present the screen on behalf of you. You can join by audio and continue your presentation.
Prashant, there's an issue from your end, I guess. We can't see your screen or hear you.
Sir and ma'am, what do you suggest, sir? Shall we wait for him or can we wrap the session, sir? Madam, what do you say, ma'am? Yeah, sir and ma'am, Prashant won't be able to present himself, so we can wrap up the session. Moderators.
Thank you, everyone. Purushottam sir and Niranjani madam, it's an honor to have you as with today. Any words, sir, Purushottam sir? Like your experience, like how did you feel about the organization and how was the presentations?
I think Sar is busy in a call. You can first ask ma'am and then you can go to
Ma'am?
sir.
Niranjani ma'am? Ma'am, am I audible?
Yeah, sir is available. You can ask sir. Saikiran.
Good evening, sir. We are really honored to have you with us. How did you feel about the presentations and any words about the organization, sir? Your experience this evening.
Hello.
Sir, we can hear you, sir.
What you are asking?
Sir, good evening, sir. We are really honored to have you with us today. How did you feel about the presentations and about any words about organization and your experience this evening?
Yeah. Thank you very much. You are organized very nicely. All the presentation, total presentation might be 13, but there are 2 to 3 absent. So near about 10 presentations, right?
Yes, sir.
So all presents are very good, very nice, and they well presented.
Yes, sir.
So thank you very much to giving us opportunity as a jury for your this event. Thanks, organizers.
Yes, sir. Thank you so much, sir.
Thank you so much, sir. We are really honored. Niranjani, ma'am.
Good evening to the organizing committee, and first of all, thanks a lot for giving me this opportunity to judge such enthusiastic students, I suppose. All the presentations were very nice, nicely presented, and nicely studied also. Very original topics they were, and also gave us a good opportunity to meet such enthusiastic students from various platforms all over India. And the immense amount of what should I say, immense amount of efforts they are putting in to keep themselves updated in the field of research is really commendable.
Thank you so much.
Thank you, ma'am. Thank you so much. We are really honored and blessed to have you this evening with us. With this note, thank you, participants. Thank you, my co-team, for helping me to conduct. Thank you, judges. Simhasalamana, are we good to leave now?
Ma'am, sir, we will contact you personally for the result. Thank you, ma'am. Thank you, sir.
Thank you, ma'am. Thank you.
Okay, thank you. Good night, everybody.
Good night, ma'am.